We have discovered a genetic biomarker for the differential diagnosis of dementia with Lewy bodies versus Alzheimer disease.
The biomarker comprises a set of 5 genetic polymorphisms which can be easily detected in blood samples. The use of this biomarker assures the true diagnosis of DLB from the onset of the disease and correspondingly an adequate treatment. Genotyping can be performed on any PCR platform.
Dementia with Lewy bodies is the second most frequent kind of dementia after Alzheimer's disease. In the United States, the prevalence of this neurodegenerative disease amounts to as many as 1 million patients. Autopsy studies in both Europe and Japan indicate that the frequency of DLB is comparable with values reported in the studies from the United States. Up to 80% of DLB patients are misdiagnosed as suffering from AD and accordingly receive AD-specific treatments that may cause an adverse reaction in as many as 50% of cases. Diagnosis of DLB is currently performed by imaging techniques, which are expensive and quite ambiguous. So far, no genetic markers for DLB have been found. Additionally, the use of blood for the diagnostic test provides a non-invasive method. The biomarker has been detected in a sample set consisting of frozen brain samples from different disease groups, all with a neuropathological diagnosis. The test provides higher specificity, 96.8%, and a sensitivity up to 60%. However, to definitively establish values for specificity and sensitivity for these biomarkers, it will still be necessary to analyse a group of patients with clinical diagnosis of DLB. 120 samples have already been obtained from different Spanish hospitals. This technology is protected by a European patent application filed in 2010. And we are seeking a biotechnology company partner who works in the field of diagnosis of neurodegenerative diseases to further develop and commercialise the technology through a license agreement.